Namaste and good afternoon. This is Dr. Srinidhi Chidambaram welcoming you to a very special Facebook Live session today. I do hope that you've all been well and still taking all the precautions for COVID safety. Though the world did open up and life was becoming almost normal, the Omicron variant of the virus is here. So now we are again in a flux on how this onslaught is going to be. One extremely critical tool in curbing the pandemic and also decreasing disease severity is the vaccination. By now, I'm sure you would have all had your 2 doses, and if not, please have them immediately. But by and large, the COVID 19 vaccination programs are well on their way all over the world. And now we also have the booster doses or precautionary doses. One group that has so far not been addressed are the children, but now the Ministry of Health and Family Welfare India has issued guidelines for starting the COVID vaccination for children aged 15 to 18 years. These guidelines would be effective from January 3rd, so that's not far away. And these are guidelines which you can read to outline the type of vaccine that is going to be used, which is Covaxin, and also the methods of booking the slots, registering, and so on. This is, I think, definitely a significant event in India's battle against COVID 19. The addition of teenagers to the vaccine program is indeed a welcome move, considering that children and teens are now the unvaccinated and vulnerable group. But for parents across the country, I'm sure there are many questions in their minds. What would be the side effects of this vaccine? Is it safe? Is it going to help their child to go out normally and to go to school or college? And is it going to be protective? What degree of protection? Is it going to protect against Omicron? Is it going to become mandatory? So many. In short, it all boils down to what best I can do for my child. So come, we are going to talk to Dr. Sharmila Pendyala, consultant pediatrician and neonatologist, Apollo Hospitals, Hyderabad, and ask her, is COVID vaccine safe for children? What does the science say? Dr. Sharmila is a senior consultant pediatrician and neonatologist with over 17 years of experience of working at Apollo Hospitals and Apollo Cradle at Jubilee Hills, Hyderabad. She's honorary associate professor of pediatrics and pediatric discipline coordinator for the MD program at Macquarie University, Sydney, Australia, is tutor for fellowship in pediatrics, Medvarsity, Apollo Health City. She was previously online tutor for the International Pediatric Certification course at the Sydney Medical School at Australia and also an honorary associate of that school. She did her MBBS and MD in pediatrics from the Osmania Medical College, Hyderabad. She has received multiple healthcare awards, including the Vaidya Ratna Award 2017 for excellence in pediatrics from the Telangana state. Also, the Award for Excellence in Pediatrics by the Indian Solidarity Council National Mahila Ratna Award for Women Achievers by IIEM, the Vaidya Vibhushan Award by the Fourth Screen Communications, and many, many more. So welcome, Dr. Sharmila Pendyala. Thank you so much for joining us in this session. And I'm so glad that you're here to give your insights on this particular new guideline that has been announced. I'm sure that our parents in the audience and others will benefit a lot from your expert views and will help them to make the decision to vaccinate and enhance their children's immunity. Over to you.
Namaste, everyone. Thanks for the generous introduction, Dr. Srinidhi. Yeah, we straight dive into the topic. I've been inundated by innumerable number of questions, phone calls, WhatsApp messages, all this last 1 year, the moment that the vaccines have come into the world. So when is my child going to get the vaccine, doctor? They're not worried about adult vaccination, their own safety, their health, very little. Most of the parents, as is expected out of a parent, is always worried more about the child. I used to tell them that the adult vaccines that have been released are there to protect you, your parents, and all the adults. And unless you are healthy, you are functional, who is going to take care of your child? So don't belittle your health and don't prioritize your child's health over yours. This is the common misconception in our culture. Particularly women health is somewhere at the bottom, while it should be the reverse. If the woman in the family is healthy, take it for granted, the children and everyone else are taken care of. That's how the social structure and family system is in India. So even now, I reiterate the importance of adults getting immunized even before the children are immunized. Why am I saying this? One reason I've already told: unless you are healthy, you can't take care of your child. The other thing is pediatric COVID. All said and done, COVID in children is extremely mild, very less of hospitalizations, really less hospitalizations, and mortality is also very less when compared to the adult group. Having said this, we now move over to the Indian scenario of pediatric COVID I'll give you a gist. The other thing is, so how relevant is this vaccine? How safe? How relevant? What do you have to expect once you're vaccinated? About pediatric COVID, I have an experience of treating, say, about 650 children with COVID, out of which only 2 are needed hospitalization. One of them had that really serious, nearly fatal multi-system inflammatory syndrome. This is 1 out of the 650 children that I have treated. And even that child, we could resuscitate, we could rehabilitate, we could definitely effectively treat all the 650 children. So the first thing I would like to say, the age group that I treated is right from newborn baby, day 3 baby with COVID to 21-year-old with COVID. The recent case that I have treated is I got a video consult from United States of America. It happens to be my friend's son. So this, from here, from a 21-year-old to the 21 hour of life, the entire spectrum, having treated and having I can still reassure all the parents out there, pediatric COVID, the success in rehabilitating a child, success in saving a child when having COVID, there are only 2 things that are extremely essential. First, any symptom, till we are done with the fear of this COVID, which still is looming large, any symptom which is off the mark, your child is sick for any reason, please take medical help. If it is less than 2-year-old, it should be on day 1, day 2. If it is more than 2-year-old, not later than day 3. Any symptom, take one video consult. All the Apollo consultants are there almost everywhere in every state on Apollo 247. We are available. One video consult wherein we know how to triage the child. Okay, this child is the one who might head towards a stormy course, or these are the warning signs that the parents have to take care. This is the overview we give once you come to us with a symptom, and we can guide you properly. So the time in which you approach the doctor is the key thing that determines the course that COVID takes in a particular person. The other thing is, this is for any and every person. If it is an immunocompromised child, any one of the transplanted children, children on chemotherapy, children on immunosuppression for any reason, like steroids or immunomodulators, these children have a low threshold to approach the doctor, even if the symptoms are not too pronounced or not too troublesome. Still, take one advice. So this is what is going to, and follow up with all the doctor's instructions, and reach an emergency if you think child is behaving abnormally, not eating well, throwing up, lots of loose stools, developing some suspicious rashes, fevers are not getting controlled, or passing reddish urine, having red eyes, all these, any of these symptoms, these are all red flags. Just go to the hospital. So if you have done these two things, take it from me, 100%. Every single child with COVID can be treated well. So now I come to the important topic of the day, and that is vaccination.
Yes, indeed.
So there was this huge discussion going on all over the world. Even now it is still going on. The discussion is, if pediatric COVID is not all that fatal, are we ethically, are we medically, are we socially right in immunizing children? Are we immunizing children because we want to protect the adults who come in contact with the children? Or are we immunizing children because we want to protect them while the whole scientific community is saying pediatric COVID is not a big deal? Why are we immunizing children is one debate that's going on, that we still leave it. But I am very happy that finally there is approval for vaccines to children. Why am I happy? The first reason is all the immunocompromised children can have a breather. These are the children who might sometimes complicate. So they can have a vaccine. The second thing is there is a lot of hesitancy among parents, which I understand as a parent myself, about sending children to school without immunizing them. So it is almost like you are traveling into a battlefield without your coverage. So it is something like that the parents are visualizing. So this is what is stopping so many children being sent to school, which is sad, because I see not going to school is causing more problems. I mean, this is something beyond discussion. Like there's no debate at all. Not going to school is causing more problems than going to school with risk of COVID. So at least this number will come down, wherein the parents are more forthcoming. Okay, my child is immunized now, I do not have a problem sending the child to school. Though I still tell all parents that vaccine is not mandatory for your child to go to school. Masking is mandatory. Mask is the most important. Vaccine is the most important tool that we always had, we will always have, and we are having at this moment to save ourselves from COVID. And note, very importantly, all people out there, even if you're vaccinated, it's a compulsory thing. Why is it so? You are getting immunized with vaccines which will prevent serious disease, hospitalization, and mortality to varying extents. The infection can always happen. Infection is the organism entering your body. Disease is its play with your system and causing the damage that it can do. The disease severity can vary, but infection can always occur to people vaccinated also. So is there no vaccine which will prevent infection, not just disease? Yes, there are studies vaccines. These vaccines, when approved, Covaxin is also doing study, and there are a couple of other, Johnson, I think, is doing an intranasal vaccine, which is going to stop the organism right at the port of entry. Till those vaccines come in, the organism, COVID virus, can always enter anyone's body, both the immunized person's body and unimmunized. Is vaccinated. I do not wear a mask. I can still get infected. Yes, my vaccine will protect me from getting serious disease most of the times, but then it will not allow me not to transmit this COVID virus to someone else unless I have masked myself. And one more thing, you are going in a public place, you are not masking yourself. A vaccinated person can always transmit the virus to you. So whether they are masked or not, if you mask yourself, you are protecting yourself largely. So mask is going to be mandatory with vaccine or without vaccine. This is what is what everyone has to know. The other important thing is the transmission right now of Omicron is unbelievably 70 times more than the parent COVID strain, and nearly somewhere around 7 to 10 times more than the deadly Delta strain. So transmissibility is extremely high. The R naught numbers are very, very high, somewhere up to 3 to 4, versus around 1 for the even the most infectious variants. So what people have to know is to mask and avoid closed places. No gatherings in closed places. No gatherings in closed places. Well ventilated places only. You have to go for, for those meetings that you cannot miss. You have to prefer meeting in open places.
So, doctor, coming back to this vaccine that is going to be given from January 3rd for the 15 to 18 age group, what is it? I mean, in the sense that, like, should people then go for it?
To the vaccine. Hello, can
Yes?
you hear me? Sorry,
Yes.
I think I was interrupted.
No.
Yeah. So how effective is this vaccine? How safe is this vaccine?
That is the
I'll
thing.
talk more about the children's context. I'll leave the rest of all the vaccines. Right now in India, the latest approval by DCGI is for Covaxin.
Yeah.
So I'll restrict my thing about Covaxin. Covaxin is extremely safe. Whatever studies are done, they have done in 2-year plus children. In fact, this is the first vaccine in the world wherein the results are out for a vaccine in children who are older than 2. For most of the other vaccines, the results are out only for 12-year plus. Covaxin is the first vaccine, is the only vaccine which is approved for 2-year plus children, including Zydus. It's only for 12-year plus. So when it comes to the safety part, yes, it is extremely safe. In fact, in pediatrics, before we talk about efficacy, we talk more about safety. We don't care if the vaccine is not efficacious enough, if we have to choose between efficacy and safety. But we want to be doubly, triply, 100 times sure that it is safe. And that is what exactly Covaxin is about. It is very safe. The only little side effects that have been reported, I've seen the reports from Covaxin submission data. So the only thing is a little local pain can be there. Very rarely, maybe a little fever and body pains. So these are much lower than what all your traditional vaccines for children are, like the DPTs that we give routinely, compulsorily. We give them at 6 weeks, 10 weeks, 14 weeks, and 1.5 years and 5 years, and every 5 years later. So when you compare it with the traditional vaccines that we already have and we are giving children, Covaxin probably has milder symptoms than any other vaccines that we are already taking. It's almost like no symptoms and no issues as far as safety is concerned. The concerns about all the other side effects that the rest of the vaccines have shown in adults, whether it's thromboembolic phenomena, whether it's facial nerve palsies, whether it's post-vaccinal demyelinations and all those, none of those are reported for Covaxin. So it's an extremely safe vaccine. Efficacy wise also, any efficacy more than 50% is known to be a good vaccine. Anything more than 70%, it's like a stupendous efficacy. And Covaxin claims efficacy above 90%. And with this data, I think to summarize, Covaxin is quite safe in children. Right now, the approval is for 15 to 18-year-olds. And I'm happy that this particular age group is chosen because for 2 reasons again. The first reason is whatever little side, complications or whatever you call seen in COVID infection in children has always happened in teenagers. It was always in children older than 12 years. So that way, and one more important thing is the interruption in education is going to affect the teens more than any other age group. Then not only are they facing learning difficulties, there has been a regression in vocabulary, math solving skills, and also because of the extensive social media interaction, there's a lot of increase in suicidal ideation, depression, anxiety, then school dropouts, teenage marriages in the lower social economic thing. All these things are more pronounced in teens. And that is the reason why the teens have to be first immunized first and sent to school and see that their routine comes back to near normal as fast as possible. So I'm happy that the 15 to 18-year-olds are given an opportunity to get vaccinated. I definitely advise all parents to go ahead without any doubt and get their children vaccinated and send them back to school.
So, is this also a two-dose protocol?
Yes, it's a 2-dose regimen. The dosage is also the same as in adults. It's 0.5 ml. And the Zydus one, which got an approval before this, is the 3-dose one, but then that's not still available. This is actually an advantage because 2 doses is always easier to administer than 3 doses. So this is a 2-dose regimen with 4 weeks apart, 28 days. Yeah.
So if a child has, if a teenager has already had a bout of COVID-19, what is the gap they should wait for the vaccine? And also, should they also take the 2 doses?
Yes, even if you have had an infection, COVID infection, we still advise all the children to go out there and get vaccinated. See, scientifically, anytime after 6 weeks from your last infection, you are ready to go and get immunized. But anything more than 3 months is beyond doubt. You probably are at risk for a repeat COVID infection. So anytime after the 6-week period of healing your body from the last infection, you're ready to go and get a vaccine.
And are they in danger of infecting adults in the house even after? So it does mean that even after vaccination, you were mentioning that we do need to follow the masking, social distancing.
The rest of the COVID, which most important thing is the masking and later on the hand washing and all those, and isolating yourself whenever you have symptoms. That is one of the most important things. The moment a child is unwell, whether vaccinated or unvaccinated, you first have to pull the child out of school and then isolate this child while you're testing this child. Isolate at home. You don't have to take the child out of the home. Isolate this child at home, get tested, followed up, and that's how it is. Yes, they have an ability to spread, but contrary to what people thought that children can be super spreaders or something, there is nothing like that. In fact, they do not spread too much, but they do have an ability to transmit this infection to others.
Children will be having their own immunization schedule for other vaccines, and so will teenagers, but not so much as the younger children. But if they have other vaccines coming up, can they do both? They can do.
Yes, very, very, very significantly valid question that you have put. I'm happy that you asked this. Yes, most of the vaccines that we already have can be co-administered along with Covaxin on the same day. Or if you don't take it on the same day, you have to have a 4-week gap between 2 vaccines. Okay. This is applied to any vaccines. Either take multiple vaccines on the same day or space them 4 weeks away. Today you take one vaccine, the other vaccine 4 weeks away. or both the vaccines on the same day. You can't take one vaccine today, one vaccine 1 week later, the third vaccine 1 week later. It doesn't work that way, either on the same day or 4 weeks apart. You can, in fact, you'll be surprised to know that, medically, you can, you are allowed to 3 antigens on the same day. If you have to talk about the theoretical thing, it's about 23 antigens you can inject a child on the same day. But yeah, like I said, yes. So beyond doubt, you can take 2 vaccines or 3 vaccines on the same day.
Are there any other further precautions that need to be taken before or after the vaccination, as in, I don't think so.
Usually what happens is, one misconception or something that everyone misses is, the moment they're vaccinated, they ignore the symptoms that might come later because of COVID vaccination, because they have this false sense of being protected from COVID. So even when they get infected with COVID later on, which is always a possibility, it does, like I said, it doesn't prevent infection. It only prevents serious disease, hospitalization, and death. So even after your child is immunized, this child develops a fever or a cold or a cough or feeling unwell, you still have to be on your toes and go and get a consult for this baby from your pediatrician. Don't sleep over it. Okay, my child is immunized, I am immunized, I haven't attended anything. I done any high risk. It is an airborne infection, and you always can contract it. Someone is coming home, you are going out without attending any important parties or anything. Also, you still can. It's an airborne infection. You will not know how you contracted COVID. You can still contract COVID, and so don't sleep over the symptoms. Once immunized, don't think you are like
permanently immune.
You're not like immune from everything and COVID all the time. No, there can be breakthrough infections, and at this point, probably I'll have to say that the breakthrough infections are higher with Omicron. So I have one more question that parents are asking me. You yourself are telling me, doctor, that the vaccine escape is higher, immune escape is higher in Omicron, and so why should I get immunized at all if it is not saving me from the infection? So people have to note this particular sentence very importantly. Yes, Omicron has higher breakthrough infections, but vaccines still will prevent hospitalization and death largely. And this is the very reason why you should get immunized.
Absolutely.
So vaccinate yourself, and that's what it is. This is the only way we build up our herd immunity, and eventually probably we are in the last leg of COVID being immunized in our lives, probably, hopefully. Fingers crossed. Omicron is probably the COVID way of bidding goodbye to us. Eventually, it's almost like nature's vaccine. Hopefully,
I certainly hope so. But there was also this. This is the question which has been kind of floating around here, that Omicron is so mild that it's good to get it. But I don't think that should be any reason for complacency.
No, you should not get into that idea. Yes, this idea actually is very actively almost propagated in Australia, where they're telling you to get a mild infection. Like, I'll tell you, I'll draw a parallel to this about there is no immunization for chickenpox in immunization schedule in the UK. They actually hold chickenpox parties where one child gets chickenpox, they invite the other children to get infected. But we, at this moment, I think we still should not be doing that for Omicron, because the long COVID or that minor amount of percentage of people or children who might get complicated. I
Yes.
still don't want anyone that I know of to have any of those, unpleasant things happening, even if it is 1 in 1 lakh. I still value that one life more. And when you can prevent it, you always have to do everything to prevent it.
Absolutely. So thank you, doctor, for this amazing discussion. And parents and viewers, now I hope that you're very clear that it is essential to get your teenager vaccinated when the turn comes. So please register and give them that gift of safety from COVID-19. Viewers, please also connect with our Facebook page for your further queries. And as doctor said, Apollo Hospitals is present on multiple locations as well as multiple digital platforms as well as video consults. So we're always there to assist you. So do not hesitate to contact us for queries, appointments, consults, anything. So till we meet again, I hope you're going to stay safe, stay COVID safe, and the rules remain the same. You know it. They're all in your hands now. The sanitization, social distancing, masking, and of course, the boosters, the precautionary doses, or if you haven't got vaccinated, please get so immediately. The world is still at risk, and this is the way to protect yourself and your loved ones no matter what. See you soon, and thank you, and namaste. Thank you, doctor.